If we were to think about an individual living in poverty, they don't have the working, reliable car. They don't have the gas money. So every day they're working to be able to get their basic needs met. So scheduling a dental appointment is just difficult sometimes. So we want them to make an appointment, keep an appointment, show up for an appointment, fill out 8 pages of paperwork. We have all of these things that we want them to do that really overwhelms them. So what we really need to do is help to break it down. And one of the ways that we have been able to help do that is to take away those scheduling pieces by going into the community and reaching out to them where they are.
A dental clinic is really more like a hospital. It really should not be something you have to go to unless you absolutely need it for treatment. And what we really need to do is to get out there on the front lines and go way upstream to pregnant women, very young children, to do the assessments and prevention there to prevent the consequences down the road.
We have educated clinicians, expanded practice dental hygienists who are going into the field. They're delivering services to people who won't or can't access care. They're providing education. They're also providing prevention and some treatment and some triage to care.
Overall, there's a lot of poverty in rural areas, sometimes as high as 30 to 32%. And historically on the Oregon Health Plan, adults for sure have not had the wide array of services available to them in preventative services. So one of the things that we did in Oregon was including adult preventative services. And many of those services we don't have to deliver in the dental office. We can deliver it in the community and then triage those patients with the greatest need to the dental office for care.
Investing in oral health, investing in prevention isn't only a feel-good initiative. This is tightly linked to a lower dollar bottom line, right? What it's going to cost the system in the long term.
We've been working to screen kids, to triage them to care, and last year out of 400 kids, we had less than 20 kids that had urgencies, which was phenomenal. Another really great example is that we went to a DHS office and screened adults. We screened 40 adults in one day. I can't see 40 adults in a dental office in a day.
We are way better off now than we were 10 years ago in Oregon. And if we keep continuing and we're able to talk about it and we're able to back it with data and stories, then I think this model could spread through the United States.